for the introduction, this topic is quite different from the other chapters because it is not limited to one part of the body or to one body system. It is an eclectic collection of injuries that can occur in almost any area of the body. The injuries range from fractures and crush injuries to burns, spinal cord injuries, and late effects of injuries. Next, in this topic, the S codes are used for coding different types of injury related to single body regions. Meanwhile, 4 T codes reflect injuries to unspecified body regions as well as poisoning and certain other consequences of external causes.
When coding for injuries, assign separate codes for each injury unless a combination code is provided, in which case the combination code is assigned. Code from category T07, unspecified multiple injuries, should not be assigned in the inpatient setting unless information for a more specific code is not available. Traumatic injury codes from S00 to T14.9 are not to be used for normal, healing surgical wounds or to identify complications of surgical wounds, but the code for the most serious injury, as determined by the doctor, and the focus of treatments should be sequenced first as a primary diagnosis. Next, we move to the primary injury with damage to nerve or blood vessels. When a primary injury results in minor damage to peripheral nerve or blood vessels, we should code the primary injury as principal diagnosis with additional codes for injuries to nerve and spinal cord, such as from category S04, which is injury to cranial nerve, and injuries to blood vessels, such as category S15. But when the primary injury is to blood vessels or nerve, we should code that injury as a principal diagnosis. Iatrogenic injury. Iatrogenic injury refers to tissue or organ damage that is unrelated to a primary disease, and it is caused by a necessary medical treatment, pharmacotherapy, or the use of the medical device. Injury codes from Chapter 19 should not be assigned for injuries that occur during or as a result of a medical intervention, so we should assign the appropriate complication codes other than codes from Chapter 19.
Before we begin, let's get to know what is the differences between burns and corrosion. Burns are resulting from electricity and radiation. For example, a burn resulting from a person when touching electrical wiring or electrical equipment. Besides that, corrosion are burns due to chemical. For example, hands are exposed to sodium hydroxide and phenol. The codes for current burns is T20 to T25 and are classified by depth, extent, and by agent, which is X code. There are 3 degrees of burns, which are first degree burns is called erythema, second degree burns is called blisters, and third degree burns is full thickness involvement. In addition, burn of the eye and internal organs are classified by sites in the code of T26 to T28. Burns should be classified with the same anatomic site and site, but if the patient have a varying degrees, it should be coded based on the highest degree burns of the same anatomic site and site. For example, a patient coming to an emergency department with the burn of second and third degree of left knee, it should be coded only for the highest degree of burn, which is T24.322, burn of third degree of left knee. Next, assigning separate codes for each burn site. When coding for multiple burns, assign separate codes for each burn site. Therefore, codes for burns of multiple sites should only be used when the medical record documentation does not specify the individual sites.
Next, I will continue to the case study. The example for case 1 is the 34 years old patient was admitted via the emergency department 3 days ago due to a traumatic rupture of the collateral ligament of the left wrist. After that, repair of the ligament was completed and the patient had no complications. Then, she is instructed to see the doctors in 2 weeks. So, the diagnosis for this case is the patient had a traumatic rupture of the collateral ligament of the left wrist. Then, for the main term, we can find in the index which is the word rupture. Lastly, for the code for this case is we use S623.312A, traumatic rupture of the collateral ligament of left wrist.
Now let's move on to the second case. An emergency department note that this female patient arrived to the ER today, and the patient note that she feels severe pain and also swelling on her right knee. And upon examination, the doctor found that the patient has acute right anterior cruciate ligament sprain that caused by slip and fall. So the diagnosis for this case is acute right anterior cruciate ligament sprain, and the main term used to look for the code in index is sprain. And under the sprain, we can look for knee, and under knee, look for cruciate ligament, and the cruciate ligament choose anterior. And then from tabular list, add A as the 7th character for initial encounter, and the code for this case is S83.511A, which is sprain for anterior cruciate ligament of right knee, initial encounter. In conclusion, this chapter 19 has code range from S00 to T88, which encompass a wide range of conditions resulting from accidents, violence, and also exposure to harmful substances. These codes are used to categorize and also track various types of injuries and also their consequences for medical and statistical purpose.